Good morning. This is Dr. Mansoor Khan. I am the founder and CEO of Persivia, and it's a pleasure to be addressing all of you today. I've been asked to talk a little bit about the impact and the AI capabilities that are sort of all over the news cycle today, and for the last few months, ever since ChatGPT became available publicly. In the context of the deployment of AI into healthcare, and specifically in the context of some of the predictions that the Gartner folks have made about what role AI will play and what specific AI capabilities are relevant to healthcare. In my career, I've seen four sort of major technological shifts come through. One was a little bit before my time, which was mainframe computers becoming highly available. Then came the PCs in the mid 80s, along with the networking revolution. Then came the dot-com revolution in the mid to late 90s. And now in sort of the 20s, we are seeing the AI revolution. Interestingly enough, in each of those previous three waves, AI has been sort of hyped. So people created AI diagnostic capabilities, or supposedly what they call AI diagnostic capabilities in mainframes. They created them in PCs. There were folks trying to do it in the dot-com era, and now finally we are dealing with large language models and all of the technology that's developed since then. So the use of AI, and especially in healthcare, has been sort of a fountain of youth, sort of a quest for the last 30 to 40 years. And I think we may have finally hit a tipping point where it becomes real and provides the kind of utility that one would need to make it succeed, not just in terms of technology, but in terms of business capability, and most importantly, in terms of something that provides value to the healthcare system that eventually impacts our ability to deliver great care. There are many different AI capabilities that we talk about, and over the next couple of podcasts, we're going to address the sort of two orthogonal views of this. Today, we're looking at the use cases for the different LLM capabilities. I view this as sort of a AI infrastructure view. And then the other view is using various components of these infrastructure pieces and combining them to create and automate and enable workflows. So for example, how do you make care management workflows a lot better, more efficient, easier, etc., using various components? But today we're going to focus on looking at some of these components, and we're going to focus on the predictions that Gartner has made. I largely agree with the Gartner's view on how AI is going to impact the delivery of care. The use cases that I think are most relevant for deploying AI into healthcare are those that were really accelerated by the COVID shutdowns. What we saw in COVID was a huge amount of burnout of nurses and even physicians being worked 24 hours a day for weeks at a time. And that caused a lot of nurses and support staff to leave their healthcare environment, either retire, take early retirement, or they were injured and were unable to work, or move into different areas that were less stressful. And so what we have today is a very big crunch in terms of the availability and cost of the resources that you need to deliver excellent healthcare, and which is a textbook case of where AI could potentially help. Of course, AI has to perform for that help to materialize and become real. And so, you kind of start thinking of, okay, so what is it that AI can do for me that would help me? And a lot of that has to do with automating sort of routine tasks. So automating tasks of, for example, as Gartner points out, data analysis, auto generation of different types of documentation. So allowing physicians and care managers, care navigators, folks to nurses to create automatic care plans, automatic generation of patient assessments, summarizing data, all of these kinds of tasks that a large language model is good at doing, which doesn't require a significant amount of intellectual horsepower, but really just requires processing a lot of information and then extracting the key pieces from that. So, where pattern recognition that AI is very good at really comes into play. So by and large, I tend to agree with Gartner's prediction that those areas where you can reduce the load on providers and enable them to perform their job with less sort of routine work are going to be areas where AI can really succeed. Of course, it has to, depends a great deal upon does the AI actually deliver that. But to the extent that it can deliver the ability to automate routine tasks and to remove friction from the workflows, allow providers to focus more on the patient and patient engagement rather than on the pieces of work, where administrative work, which is a significant percentage of a provider's time today. And unfortunately, the advent of EHRs have actually made that worse, right? So providers used to be able to scribble a few notes onto a piece of paper, stick that into a file, and then move on to the next patient, and focus their time on talking to the patient and understanding the patient. Now I have to spend significant amounts of time putting the right information in the right place within the EHR and making sure that it's coded and it's available, et cetera, et cetera, et cetera. So that is really playing a huge role in provider burnout. And so all of these kinds of things is what AI can reduce and make it easier for providers to adopt it, and very importantly, give them a return on their investment, actually make their lives easier, make it easier for them to spend time with their patients, and therefore improve job satisfaction at the same time as reducing some of the administrative burden that they face. But as I've been, as I've thrown in caveats throughout this conversation, it's critically important that AI actually deliver what it's promising, and that is, that's still somewhat of an open question. But we think that we are getting to a tipping point on that also, where AI will start delivering enough capabilities in an easy enough manner that you could deploy it at scale. But the other side of that coin is, are providers ready for it, and what organizations are more ready than others to deploy AI and to use AI? And that's a very complicated question. That's not an easy thing. It's not like saying, okay, if you have an EHR, you can deploy AI. It depends upon your workflows, depends upon sort of where you are in the care continuum, inpatient, outpatient, post-acute, what tools you're currently using, how good your data today is. So all of those pieces need to be thought through. So when picking an AI system or starting to think about deploying AI, you really have to think about how the data coming into it will be managed, what the AI system will do, what the EHR will do. And unfortunately, most EHRs today are sort of talking, pretty much everybody talks about AI today, but most EHRs today are incapable of deploying AI at any scale, because they, one, have very limited view of the data. They're not seeing a lot of the other data that would be relevant to AI. So most EHRs would only see the data that's within their databases. They don't see data from other EHRs. They don't see data from claims or SDOH data. Many times ADT feeds and even claims data is missing. So they have a limited view, and to the extent that they have access to those other data streams, they're typically not integrated and not normalized. So the AI would have trouble trying to understand what it's looking at. So the answer to how ready are you is, unfortunately, depends. And that's an area that we as Persivia are really taking a very serious look at, is how do we solve this problem of delivering AI at scale and deliver the data management, data cleansing, data maintenance capabilities along with that. So it's a single solution, one-stop shop for deploying different AI capabilities. I think I'll pause here, and we'll see you in the next podcast. Thank you for your time, and great speaking with you. Bye bye.